Ancient Indian and Chinese surgeons reportedly experimented with skin grafts, and Italian surgeon Gaspar Tagliacozzi performed nose reconstructions using skin flaps in the 16th century. Yet these early efforts were limited to superficial procedures, as the concept of replacing entire organs was far beyond the reach of science. The true turning point came in the early 20th century when scientists began experimenting with animal-to-human transplants, a field known as xenotransplantation. Soviet scientist Vladimir Demikhov famously transplanted animal organs, including hearts and lungs, into dogs in the 1930s. While these experiments were groundbreaking, they were plagued by organ rejection, a problem no one knew how to solve at the time. The first human-to-human organ transplant success came in 1954, and it wasn't just a medical breakthrough, it was a story of hope and courage. In Boston, Dr. Joseph Murray led a team that transplanted a kidney from one identical twin to another, Ronald and Richard Herrick. Since the twins shared the same genetic makeup, rejection was avoided, and the transplant was a success. Ronald saved his brother's life, and the procedure earned Dr. Murray the Nobel Prize decades later. This was the moment transplantation went from science fiction to reality. Over the next few decades, the battle against rejection dominated the field. Early pioneers like Dr. Thomas Starzl experimented with immunosuppressive drugs, which suppressed the immune system to prevent organ rejection. By the 1960s, the development of drugs like azathioprine and later cyclosporine revolutionized transplantation, allowing organs to be transplanted between unrelated donors. Suddenly, kidney, heart, and liver transplants became viable options for patients worldwide. One of the most dramatic moments in transplant history came in 1967, when Dr. Christian Barnard performed the world's first successful heart transplant in South Africa. The patient, Louis Washkansky, survived for just 18 days due to pneumonia, but the procedure demonstrated that even the most vital organ could be replaced. It captured global attention and inspired rapid advancements in surgical techniques. Kidney transplantation led the way as the most successful and widely performed transplant procedure. By the 1980s, surgeons refined techniques like living donor transplants and split liver transplants, which made better use of scarce donor organs. Groundbreaking procedures followed, including the first successful hand and face transplants in the 2000s, highlighting the field's expanding possibilities. Today, the story of transplantation is still being written. Scientists are exploring 3D printed organs, bioengineered tissues, and genetically modified pig organs to address the global organ shortage. In 2022, a man received a genetically modified pig heart in a landmark xenotransplantation procedure, offering hope for the future. Along the way, transplantation has provided incredible stories of bravery and innovation. In 1954, Ronald Herrick became the world's first living organ donor, saving his twin brother's life. In 1984, the case of baby Faye, a newborn who received a baboon heart, pushed the boundaries of medicine, though it ended tragically. These moments illustrate not only the scientific challenges, but also the deep human connections that define transplantation. From ancient skin grafts to cutting-edge lab-grown organs, transplantation is a testament to human ingenuity. What was once an impossible dream has become a lifeline for millions. This remarkable journey reminds us of our ability to push boundaries, save lives, and transform the future of medicine.